Reform or die, that's what the UK's Prime Minister Keir Starmer has told the NHS. NHS is the UK's National Health Service. It has been in a really bad shape for years now. This week, a damning report came out. It laid bare the critical state of NHS, from the crumbling infrastructure to the ballooning waitlist, which stands at 7.6 million. That's how many people are waiting for healthcare in the UK. So Starmer has come up with an ambitious but controversial idea. He has promised a 10-year plan. He says money will not solve the problems. What the NHS needs is a complete reform. But can this decade-long plan resuscitate the National Health Service? Here's a report.
The NHS is in a critical condition. We aren't saying this, a damning report is. NHS is the UK's National Health Service. It has been in crisis mode for years now, but now it faces its worst crisis ever. A government-commissioned independent review was held, led by independent peer and NHS surgeon Ara Darzi. The report's findings have shocked the nation. Darzi says that NHS is in, quote-unquote, serious trouble. The productivity is declining. There are cancellations of more hospital treatments than any comparable country. The waiting list is ballooning. It currently stands at 7.6 million. Last year, more than 100,000 infants waited more than 6 hours before they were treated. This year, nearly a tenth of all patients are now waiting for 12 hours or more. Darzi says the NHS emergency services are in an awful state. The infrastructure is crumbling. Patients with long-term physical ailments like diabetes and respiratory problems are not getting the help they need. Meanwhile, patients with mental health problems are left in, and we quote again, Victorian-era cells infested with vermin. So the NHS, instead of healing people, is causing about 14,000 more deaths every year. Like we said, this is a damning report. And British Prime Minister Keir Starmer shares his country's shock.
Until this morning, we didn't know the full scale of the damage, which is laid bare in the report. Even Lord Darzi, with all his years of experience, is shocked by what is discovered. It is unforgivable, and people have every right to be angry.
So what is Starmer's solution? Well, no more funding. The irony is almost painful. But the Prime Minister says that the NHS's problems will not be solved by more money. The NHS needs reform. Starmer says the NHS can reform or die. So what is he going to do? He has promised to draw up a 10-year plan. He calls it the biggest reimagining of the NHS. This reimagining will only appear in spring next year, so the details are not clear yet. But it will focus on 3 key areas. First, the transition to a digital NHS. Secondly, moving more care from hospitals to communities. And thirdly, focusing efforts on prevention over sickness. Now, this plan is highly controversial. Yes, the NHS needs to be transformed completely. Yes, this will take time. But right now, the NHS also needs urgent help. Critics say that small changes over a decade may invite the slow death of the NHS. Yet Starmer remains hopeful.
The NHS may be broken, but it's not beaten. As the report says, the NHS may be in a critical condition, but its vital signs are strong. And we need to have the courage to deliver long-term reform. Major surgery, not sticking plasters.
The surgery carries major risks. Will it do more harm than good? Well, as the cliché goes, only time will tell. But by then, the NHS may have no choice between reform or death.